Mouth and Oropharynx assessment. Equipment: clean gloves, pen, light water, salty and sweet
Good day,
tongue
everyone.
depressor.
My name is Kimberly Namuag, a student nurse from GH Sirleaf State College. So for today's demonstration, I'm going to assess the mouth and oropharynx. So, number 1, prior to performing the procedure, introduce self and verify the client's identity using agency protocol. Explain to the client what you're going to do, why is it necessary, and how he or she can participate. Discuss how the results will be used in planning further care or treatments. So, ma'am, my name is Kimberly Namuag, and I'm going to assess your mouth.
Okay.
What is your name, ma'am?
Marian Cristinas Delas.
Your birthday, ma'am?
June 2, 2001.
How old are you, ma'am?
19 years old.
Okay, so ma'am, I will assess the mouth in order to detect abnormalities of lips, gums, and teeth, oral mucosa, and uvula, and allows early detection of oral cancer. And then, next procedure, perform hand hygiene and observe other appropriate infection prevention procedures. And the next procedure, provide for client privacy. So ma'am, I will just close the curtain first to provide privacy. And the next procedure, inquire if the client has any history of the following: routine pattern of dental care, last visit to dentist, length of time ulcers or other lesions have been present, denture discomfort, medications client is receiving. Okay, so ma'am, is there any history of the following, like routine pattern of dental care,
No, ma'am.
last visit to dentist,
No, ma'am.
ulcer, do you have ulcer, ma'am?
No, ma'am.
Denture discomfort, you don't have any.
No, ma'am.
Medications,
No, ma'am.
and then next, position the client comfortably, seated if possible. And then inspect the outer lips for symmetry of contour, color, and texture, and ask the client to purse the lips as if to whistle. Can you purse your lips, ma'am? And then, inspect and palpate in your lips. Apply clean gloves and then ask the client to relax the mouth, and for better visualization, pull the lip outward and away from the teeth. Grasp the lip on each side between the thumb and index finger. And then note for color, moisture, texture, and the presence of lesions. So I'll just apply clean gloves first.
No, ma'am. Ito.
Next procedure, inspect the teeth and gums while examining the inner lips and buccal mucosa. Ask the client to open the mouth and then using a tongue depressor, retract the cheek. View the surface buccal mucosa from top to bottom and back to front. A flashlight or pen light will help illuminate the surface. Repeat the procedure for the other side. And then ask the client to relax the lips and bite down as though chewing on something and note alignment of the lower and upper jaws, then open the jaw. Then next, examine the back teeth. For proper vision of the molars, use the index fingers of both hands to retract the cheek. Observe the number of teeth, tooth color, the state of fillings, dental caries, tartar along the base of the teeth, and then note the presence and fit of partial or complete dentures. And then inspect the gums around the molars. Observe for bleeding, color, retraction, and then pulling away from the teeth, edema and lesions. And then last, inspect the stems and ducts. Bali ako ba naman?
Wala. Wala kayo na mamana.
Ang resulta?
Ang resulta, 70% sa looking. Agad. Okay. Oh. Ang isa sa tulawas, lahat kayo na. Kung kaya kita madalo, isang pagwate. Naman, palito na sa silikon. Ilang yung resulta.
And the next procedure, inspect the dentures. Ask the client to remove complete or partial dentures. Inspect their condition, noting in particular broken or worn areas. So our patient has no dentures. And then we'll proceed to the next procedure. Inspect and palpate the surface of the tongue. Ask the client to protrude the tongue. Note for position, color, moisture, size, and texture. Observe for fasciculation and check for midline protrusion. Palpate any lesion present for induration. Okay, so ma'am, can you protrude your tongue?
Sige, isa ka na, sige. O, ako ang isgutan nun. 9. Kung natin anak na nagkasapa sa ulo, natin organic germanium, utang-utang sa nagpapala sa ugat.
And the next procedure, assess the ventral surface of the tongue. Ask the client to touch the roof of the mouth and use the pen light to inspect the ventral surface of the tongue, frenulum, and area under the tongue. Then palpate the area of if you see lesions, and then palpate the area if you see lesions if the client is over age 50 or if the client uses tobacco or alcohol. And then note any induration. So our patient doesn't use tobacco and alcohol. So we're going to assess the ventral surface of the tongue. And then we will also inspect the Wharton's ducts.
Okay, okay. Kung sa rason yan ang dili, kaya ano? Ang cellphone man ko, buti
procedure, observe the size of the tongue. Use a square gauze pad to hold the client's tongue to each side, and then palpate any lesions, ulcers, or nodules for induration. In the next procedure, check the strength of the tongue. Place your fingers on the external surface of the client's cheek, and then ask the client to press the tongue's tip against the inside of the cheek to resist pressure from your fingers, and then repeat on the opposite side. Next procedure, check the anterior tongue's ability to taste. Place a drop of sugar and salty water on the tip and sides of the tongue with a tongue depressor. Muna na tayo, ma'am.
Okay. Isa ba yung hiling ng palami? Di ba ang lalaki? Gusto kayo maminsin ng lalaki?
Sugar.
Di ba? Maminsin. Pero ang babae, ang babae ito, hindi lang nagawa. Sa ulo, natin, organic germanium, utang-tang sa wala sa sugar.
The next procedure, inspect the hard or anterior and soft posterior palates and uvula. Ask the client to open mouth wide and tilt the head backward, then depress tongue with a tongue depressor halfway between the tip and back of the tongue, as necessary, and use a pen light for appropriate visualization while you use a pen light to look at the roof. And then observe color and integrity, and then note odor while mouth wide open. Next procedure, assess the uvula for position and mobility while examining the palates. To observe the uvula, ask the client to stay up and watch the uvula and soft palate move. Ma'am, say In the next procedure, inspect the tonsils. Use the tongue depressor to keep mouth open wide. Inspect tonsils for color, size, and presence of exudate or lesions. And then grade the tonsils. procedure, inspect posterior pharyngeal wall. Press the tongue depressor against the tongue on the same side about halfway back while the client tilts the head back and opens the mouth. Shine the pen light on the back of the throat. Observe the color of the throat and note any exudate or lesions. In the next procedure, remove and discard gloves and perform hand hygiene. So I'll remove my gloves. And then document findings in the client record using printed or electronic forms or checklists supplemented by narrative notes when appropriate. So here's the overall documentation. And that's it for our mouth assessment. Again, thank you, ma'am, for your time. Again, this is Kimberly Namuag, a student nurse from GH State College. Thank you so much for watching.